Cold thermogenesis. What is it? It is known as a hormetic stressor. And a hormetic stressor is something that is designed to have a short term bout of stress, and it's going to make you stronger in the long term because of it after you recover. So, some more examples would be exercise, fasting, sunlight, heat, and cold is what we're going to be discussing today. So, if we talk about the history of this, it goes way back. Like, our ancestors have been doing this forever, honestly, but Hippocrates, the father of modern medicine, we know that he was very big on this. He did it with his patients for a variety of ailments. He knew that it strengthened the body, he knew that it helped as an adjunctive therapy to recover from certain chronic diseases. If we go back to ancient warrior societies like Sparta, we know that they indeed used this for their training to be more adaptable in battle. If we talk about the monks, they also used it as a form of connection and as in their enlightenment practices as well. So it has a wide ranging use here. So let's get into the benefits. Number one is going to be activation of brown fat or brown adipose tissue. Now this is the type of fat that burns fat. So the reason why it's brown is because it's so dense in mitochondria. And mitochondria are essentially the energy factories of these entire cells. So brown fat is going to be activated by cold therapy, and because of that, we're going to see an increase in fat loss as well. So number two is improved circulation throughout the entire body with the blood vessels constricting and dilating. Number three is that increases immune function. Cold therapy has also been shown to enhance things like our white blood cells, which improve immunity. Number four is going to be blood glucose regulation. Now this goes back to the white to brown fat conversion, because brown fat is also very good at regulating blood glucose. Number five is recovery. This is well known to be good at recovering from exercise, things like that. So there are a couple caveats though. Like if you're doing just a regular exercise session, you don't want to necessarily do a large 20-minute bout of cold therapy because it can blunt the hormetic response to exercise, which is basically the response that helps you grow and adapt from exercise. So, but if you do like a 2 to 5 minute cold shower, that's all good. Just you kind of want to avoid the large amount unless you're doing like a marathon or something like that. So let's actually get into the methods of how to do this. So number one is going to be a cold shower. This is going to be most accessible to people. All you need to do is really 2 to 5 minutes of cold therapy, and the way you can start out is just doing 30 seconds, right? Don't do it as cold as possible. Maybe do, and then you work your way up. Just add more time, add more temperature, and that's all you need really. So we're gonna get into number two, which is gonna be cold immersion. So this is like cold baths, cold soaks. The difference is that it's full body immersion, while the shower it's not full body necessarily. You have to aim, right? So the thing about the cold shower though is that it's dynamic. So it's like the water is constantly moving, so it does have that aspect of it that's more difficult, while the cold immersion is more static usually. So same thing, 2 to 5 minutes. And by the way, the temperature about this is 56 degrees at least, or the minimum effective dose. You always can go colder if you want to, but about 56 degrees. There are many companies who have pre-made cold immersion tubs, and many of them are good. They use things like ozone filtration, UV filtration, so you don't have to constantly change out the water. That's known as a Morosco Forge. But getting a good high quality cold plunge will be a great investment in your health. And in addition, you also can go in a natural cold body of water. This may actually be the most beneficial because you're getting all the other things that go along with that. So if you have like a cold lake, that's all good. Last piece I'm talking about here is how to approach the cold with the mindset approach. So we talk about Wim Hof, right? He's the Iceman. He has a lot of breath work that makes it easier and as a conjunctive therapy for the cold. So like there's so many breathwork practices that make it easier to go in the cold. It is difficult initially for a lot of people, but What you really want to do is focus on the breath, focus on calming the mind and the body, focusing on calming your thoughts, and take a stoic approach to it, because how you train here is going to take stock in other points of life. Like, this is not just being better at cold. You can take this stress resilience practice into any situation. So it's essentially training ourselves to be more resilient in the face of adversity. Very powerful.